No.
Okay. Okay. So we're going to be going over art lines, but before, I'm going to be going over again art lines because it's one of those things that we have to go over many times for students to understand well. But before I do that, I want to go over some procedures and FYIs for how the arms are to be treated, because it's very important. If these are not done right and you're not sticking in the right places, then the arms are going to leak. So first and foremost, this is not an area where we stick for art lines, and this is not an area where we stick for art lines. These are for other procedures that could be done for nursing students. And this is nowhere near a radial artery, so don't think that this is where you're supposed to stick just because it's there. The radial artery is here, and it's in here just like it is on a normal patient. So when you're doing your procedure sticks for your arterial lines, they should be right along the same place that you would stick if you were sticking on a real human being. So inside of here is places where these have to hook in, and you will see that these little places here sometimes become loose. So it is your job to never touch this area and don't mess with it, because Miss B, the other Miss B, or myself will take care of it. And if people are messing with this area and moving things around, that's when the arms start leaking. And so that's why we have no business poking there. So we've already put them all back together and asked that you leave them that way. When you take the arm out, it's going to be wrapped like this, and it's going to be in the control room. You will be escorted into the control room where you can get these. When you carry them like this with the cord on it. And then make sure you don't tilt it or turn it in any way. And very carefully, you'll carry it like this to the table where you're going to go. You can open this up, and then this is an automatic place where you can have a little pad underneath where you're going, and then you leave it on a flat surface like that. Another housekeeping 101 on these arms is that you do not tie off the end of these. This is for the arm to drain. It has a clamp. As long as the clamp is clapped, there's no reason why any fluid should be leaking out of here. And I've seen knots put in these before. May or may not be your class. It doesn't matter. I'm just talking about it so that it doesn't happen. So when we do drain the arms, we need this line to not have been messed with. So there should be no knots in it. And as long as you're using the arm, there should always have this clamped off. There's no reason to have fluid coming out of here. If it leaks, it's because this wasn't clamped properly. Again, there's no need for you to adjust these, and there should be no need for you to do anything with the water. That should all be pre-filled for you ahead of time so that you don't have to do any of that. Our bag today doesn't have a ton of water, but that's okay for what we're going to be doing. These will be unclamped when we're actually running them and trying to do our sticks. You plug in the arm into the outlet, and then these two areas right here will give you your pulse and your pulse strength. You're not going to feel the artery on this arm like you will on a normal person. That's fine, because in the classroom we're just working on technique and not concerned about necessarily if you get a really good flash or blood flow return. As long as you're able to stick where you want to stick and get the line in and can show us and everything works, then we're fine. The rest you don't need to worry about. So that's arm technique 101. If you have any issues whatsoever, you're not to mess with the arms. Please get one of the instructors so that we can work on it, because we all know what we're doing with them. Okay, so now for your actual art line procedure, we have our fenestrated, our non-fenestrated drapes, our 2 packs of sterile gloves, our pressure bag, our water with transducer and line in it, and the transducer is right here, which I will go over again in a minute. We have our chlorhexidine ring. We have our iodine or chlorhexidine to clean the site. We have our bouffant cap. We would have a mask, but we're out of supplies right now because we're supplying the hospitals. So for today and while you're practicing, you can just verbalize that you're putting on your bouffant cap and your mask, because we don't have any. And then you're gonna have your kit. Your kit is gonna have your catheter, your sheath with guide wire, and your needle. And that should be everything you need to get your art line set up and done. So of course, we're always gonna make sure we have a doctor's order, and then hopefully patient consent has already been done, or we're gonna get it now. And then first thing you're gonna do, if you're going into the room, you're gonna have your bouffant cap and your mask with shield on at this point. You're gonna come into the room, you're gonna, of course, wash down, foam in, foam out. We could put our gloves on and we can go ahead and do our Allen's test. Let the patient know what we're gonna be doing if they're awake. Many times they might be out and asleep, so you won't have to worry about that. A lot of times these are done in OR. So we're gonna do our Allen's test first to make sure that's good. And just a reminder, if the patient is not awake, you can do the Allen's test for them. We're going to occlude both the radial and ulnar arteries. We can pump our, sorry about the coughing, patient's hand if we have to. Then we can open it and release our ulnar, release our radial. Can you tell I don't feel good?
Yes, we can tell.
Sorry. Release our ulnar, make sure we have collateral circulation, and we get our pink back. Y'all know what you're doing with the modified Allen's test. Okay, so we did that and it was good. So now we're gonna go ahead and clean our site. Chlorhexidine or iodine. These come with 3 swabs in here. We're not gonna actually take them out because they'll make a mess. But remember, you're gonna swab in and then out in an outward motion 10 seconds, then get a new swab and continue outward, and then get a new swab and continue outward. And then you're gonna let that dry while you're prepping the rest of the procedure. By the time you're done, then that will be ready. And then next thing we wanna do is get our supplies ready. So we're gonna have our saline bag. You may just have a bag of saline or you may have a bag of heparinized saline. It's just gonna depend on the facility where you're at. When you get this together the first time, it will not come with the line already punctured in the bag, but we've gone over that. You know, just pull the cap off, puncture the line, and then you should be good to go. And then we're going to insert this into our pressure bag. For the art line to work properly, we need it to have proper pressure, or the blood will not stay in the patient and you will not be able to get a good blood pressure reading and you'll have backflow. So we'll go ahead and insert our bag into our pressure bag. And then you're either gonna have a little plastic clip that it can hook on or something that you can use to make sure it doesn't fall back down. And then you're going to inflate this to a pressure of 300. To do this properly, you have to make sure your stopcocks are aligned properly. Remember that this is pointing to the off position. So right now, I'm pointed off to my pumping balloon right now, so I can't pump anything. If I turn it this way, I'm off to my bag, and anything I pump is gonna come out here. So the proper position for inflating the bag is to turn off to the environment. And remember that I have a straight line, and so my straight line is either going to be where air goes or where fluid goes when the line is actually in. So now I can inflate this up to 300, and you'll see it'll go into the green. Sometimes you have to push these up a little bit so they don't fall down too far, so you don't blow up your bag. So now we're at 300 in the green. And now that we're in the green, we want to take our stopcock and turn it off towards the bag, so that way none of the air leaks out this way. So this means all the airflow is off, which means it's all going to stay into the bag. Then we're going to flush our line so that we can make sure it's all the air is put out. So you can either do this over a cup or whatever you have. When you do this also, you have to make sure all your stopcocks are positioned correctly. Remember that the little arrow is pointed to the off position, and we want flow to be able to go through the line. So there's little arrows there that show that flow would be going through, and flow would be going through here, turned off to here. So when I flush, I need to have all those turned off to their ports, and you'll see water will come out the end. And that will be how your line will work here to show it's working correctly.
Will you squeeze it again to show them?
Yep,
Okay, so she squeezes there.
yes. You can also pull the little pigtail and it'll do the same thing, but squeezing does a better job. So I just squeeze there, water comes out there. We see we have no air bubbles. And then I would just go ahead and turn this off to the bag so that nothing's gonna leak out while I'm finishing the rest of my procedure. But now it's ready to go for my patient. So now I have to prep. For our purposes here, we're gonna make a sterile field and then use that sterile field. You might get an Artline kit that already is pre-packaged with blue drapes around it. If that's the case, then you'll use the blue drapes that are around your Artline package to make your sterile field. And I'll show you at that, when I do my drape, how that would look. So I'm going to go ahead and take these gloves off now. And at this point, you're gonna want your non-fenestrated drape. Non-fenestrated means it doesn't have a hole in it and that it's just a big open drape. When you open the sterile packages, you have to remember that if the non-sterile part of anything goes past the blue line here, it is now no longer considered sterile. So the way I open up packages is I take my fingers and I put them underneath, and my thumbs and I put them there so that I can just open it like this. I see people do all kinds of things. They try to open them like this, or they're just trying to rip them open, and you've now contaminated your package and it's no longer sterile. So to keep it sterile, like this, and then we're just gonna open it without it touching anything and just laying there like so. And then I'm gonna open my sterile gloves. So this tray is gonna become my sterile field. So since this is a sterile drape right here, I can't make a sterile field until I make my hands sterile. Otherwise, if I touched it anyway, it's now contaminated. So if you have a blue draped package, they're dark blue towels, and your Artline comes wrapped in the dark blue towels, then you would put that package down here on your sterile field, and then you could open your drape. And the way you open your drape is always away from you, and then like that, and then like that, and then like that. You would see they have little tabs on them, and then all your sterile stuff would already be there. But you know, that's in a perfect world, and we don't always have that. So we're gonna make our sterile field. That's the easy way. Just open up your gloves, and I'm gonna put them on. This is the easy part. Just open. Put them on. Don't go crazy adjusting anything until you get your other sterile glove on. So now I can do my other sterile. Don't cough on it, please. And I can put that hand in. As long as I don't touch anything, it's sterile as well. Now I can go back and fix this one the way I like it. Make it sterile. Ideally, up your arms is where you want those to go. So remember that this is the sterile position. This is the sterile God said that you have to be like this, like a mummy dinosaur, whatever they call it. I'm in the sterile position, so like this. Don't do this, don't do this, don't do this, because then you can basically non-sterilize yourself with this air, I guess. So, gotta stay like this. So, you'll see people in surgery, once they're standing like this, it's because they're in sterile position. So now I can take my sterile drape, and I can lift it. And what I'm gonna do now is I'm gonna take the two corners, and I'm going to basically let it fall. Like so. Hopefully we don't have to do a lot of shimmy shaking. And then I can just let it gently fall like that. And I now have my sterile field. Remember that anything one outside, 1 inch around the edges, or if your sterile item, when you place it on here, if it falls off the side, even if part of it's on the sterile field, it's no longer sterile. Now, if you like, you can leave these sterile gloves on because you're gonna make them non-sterile. I don't like to do that because then people forget. So I'm gonna take my sterile gloves off because you still have to get sterile again later. And I'm gonna get rid of this. And I'm gonna get ready to get the supplies for my procedure now. When you put your supplies on the drape, you wanna put them in order that you're going to be using them. So we need our chlorhexidine ring is going to be one of the very last things we do here. We could have our little Tegaderm coverage too, but we don't have that right now, which is fine, because that could go on here. So our chlorhexidine ring is this little blue ring. It's going to go on one of the very last things. Do we have a Tegaderm cover over there? Hold, please. No, don't, because it's okay. Do you have a package for one? Did I see a package?
I have this, can you pretend?
Oh, no, that's okay. So if you had your Tegaderm patch, you could go ahead and put that on here. I'm gonna go ahead and open my chlorhexidine ring, remember? So when you open packages, you never open over the sterile field. You're gonna open away from the sterile field. So I remember how I told you to open it, and you're gonna dump and step back. You don't go like this. You don't open like this and then go like that. You don't do this and go like that. None of that works. And typically what happens is a lot of times it'll fall off the table, and then it's really not gonna be good. So the next thing you wanna put is your line supplies, because that's what you'll need. And then on the very top is gonna go your drape. So this would be opened like this, not over the sterile field, but away. And again, you're gonna open, dump, and step away. Open, dump. It's stuck. Well, there we go. That's not perfect, but we pre-made our packs, so they're not as perfect as they'll be in the real world. In a real world, that would fall right out. If you had to, in a sterile environment, you could get someone who's sterile and ask them to get that for you. And then I'm gonna open my fenestrated drape. That's gonna be the drape with the hole in it, and that's gonna be the very last thing I put on top here. So again, I'm gonna open, I'm gonna dump, and I'm gonna step away. So that's the way you properly place things under sterile field. And now I'm gonna get ready to do the procedure. So I'm gonna put on my sterile gloves. My second pair. Some hospitals will have you be in full sterile gown and everything for this procedure. We will be covering, that's called closed sterile technique later in the term. This is open sterile technique when we're just wearing sterile gloves. CDC guidelines at a minimum recommend mask, bouffant cap, and sterile gloves for arterial lines. So that's all so I did touch that, but I hasn't touched anything else. So now I'm going to put my other hand in. And now my hands are sterile again. So I can just do this to get it out of my way. Works very well. So now I'm gonna go to my patient, and I can either get someone to do it for me, or I can move my tray over closer for me. And now I'm gonna drape over the place where I plan on inserting the arterial line. So again, the ends, and we'll place our sterile drape. Again, we're not really touching anything else because we have our sterile gloves on. And now that's the area where I'm gonna put, and I'm going to get my needle first, and this is all sterile.
Oh, we got a leak.
Oh no, oh heck, we sure do.
Shoot.
Take it and undo the pressure and turn it upside down. Our bag is leaking at the moment. We'll come back to that later. Okay. And I can't get this open either. Oh, there we go. So I'm gonna take my needle first. So in the technique we use here, as I told you, is the Seldinger technique. It means it's over the wire. So we'll be using a guide wire to insert our arterial line. So we have our bevel just like we do for an ABG, and it needs to be bevel up. We don't stick at the same angle as we do for an ABG for an arterial line. So we're gonna take this, and if my line was on, which I'm not gonna turn it on right now, feel for your pulse, and then stick at about in between the 30-45 degree angle, and you're going to insert your catheter till usually you'll see a little bit of flash. If you do, that's fine. If you don't, that's fine too. excuse me, you're gonna take your needle out, and remember you're going to recap it, never using your other hand, just to never, ever, ever leave a sharps on the table uncapped. Next thing we're gonna do is get our guide wire. I can pull it out of here. So when you insert the guide wire, there's a little bit of a technique to this. You can kind of do however you want. You need it to be sterile. But the technique with the guide wire is once you insert the guide wire, you have to actually push it forward and kind of pull the catheter out at the same time, or you feel like your guide wire is not gonna go in. So you do have to give it a little oomph, or otherwise it just kind of sticks there. So I'm pushing my guide wire in, and now I'm pulling my catheter out at the same time, leaving my guide wire in for placement of my arterial line catheter. So now I'm gonna get my catheter, and I'm gonna line it in over the funky end of this curved wire. If I can see what I'm doing without my glasses on. Gotta really get it up there. It's a little bit of a treat. So now I got my catheter over my wire, and I'm going to advance this all the way back down to the patient. This one's being a bit of a booger. Okay, there we go. We won't use bending ones in class because they don't work well. Well, I don't know that this is gonna go over this, guys. So the idea would be your catheter would go all the way in. This wire's too bent. And then you can insert the catheter in with people that you, sometimes if they have tough skin, or you need to do a little nick there with a scalpel, you can do that right here to get your catheter in. But ideally,
But we won't be doing that on these arms, correct?
no, we're not gonna nick them with scalpels. See if I can get it past this bad boy. Ooh, I got it. Okay. So you're gonna see the wire come out the other end here in a minute. So once it does, I'm gonna pull my wire and advance my catheter like that. Makes it a little easier. So now I can advance this catheter into the patient. These you gotta push a little hard. And we're not gonna push these in all the way, they won't go. And please don't leave the wire in the patient. So we're just gonna advance this enough to do what we need to do here. And then I would advance it all the way if it was my patient, and then I'll take the wire out. And now that this is in, it's gonna be squirting blood everywhere. So we're gonna take it and we're gonna hook it up to our line. And we're gonna screw it in place. And we're gonna open, this is all done anyway, so so I've now done so I can touch. So we're gonna make sure our line is open here so that we have water flowing. Make sure all of our ports are open. So this one needs to be off to that. This port is a little different than what I started with, but it's gonna be turned that way, which means it's open. And then if I fleshed my line with my little thing, you should see water go through, which you can, but it's gonna be hard to see on the video. So I've now fleshed my line. So I know my line is working. If I was hooking this up in a hospital, I would now hook up my monitor to it. And I would, before I do that, I need to zero the transducer. The reason we're zeroing the transducer is because we also have to take into account the atmospheric pressure in the air. So to zero the transducer, we're going to turn the stopcock off to the patient, and you're gonna open up the port here. As soon as you do that, it's exposed to atmospheric pressure. It will take out that amount of atmospheric pressure in its readings. So that's what we mean by zeroing it. So now that it's zeroed, I can put the cap back on. I can turn this stopcock off to the port because I want it to be open to the patient. And now I can actually hook it up to my blood pressure monitor, and I should verify for accuracy that I get a good reading. Then I'm gonna put my chlorhexidine ring on here. I can tear away my drape at this point. Put my chlorhexidine ring on with this all the way down here. This, they've encouraged us to not wrap around the thumb anymore, so we'll just put it like this and then use your Tegaderm to seal it into place. And that's it. The end.
Thank you.
Okay.